like right now, my supervisor, hemophilia is a very high cost disease state because if patients start bleeding, they don't clot, right? I mean, if you get a cut on your hemophilia is basically a lack of like a certain factor in the blood. There's a bunch of different hemophilia, and depending on the different factors that you don't have, you know, the like clotting cascade, like with the like different factors in the blood and all that.
Yeah.
Like somewhat, like you don't really need to know it like in depth or anything.
You know it in depth.
Yeah, I mean, like it's dog shit. It sucks. But
I know it's a recessive X gene trait.
Yeah, it's definitely a recessive bleeding disorder.
Mainly affects men.
Wait, what?
Hemophilia.
Yeah,
mainly affects guys.
Yeah, men because they have the XY. So
okay.
You need to have both X chromosomes if you're a girl to be recessive, whereas a guy, if one of their parents is a carrier and or if their mom is a carrier and they get the hemophilia gene because they get their Y from their dad, then they're going to have hemophilia, as opposed to a girl, if their dad doesn't have hemophilia and doesn't carry it, but the mom does carry it, they could have a hemophilia gene and a normal gene, and the normal gene is going to override the hemophilia gene.
Okay.
But hemophilia is a really high cost disease state because if they get a cut or a scrape or something, they're bleeding, and they don't have access to medications that stop the bleeding, they have to go to the hospital, which immediately, like if you use a hospital, it's very expensive because everything is just expensive in a hospital. So right now the project I'm working on is like trying to figure out what the best option is for treatment for those patients. Because there is a lot of new treatments coming out, like with gene therapies, which are like more lifelong treatments where you give a gene, you give a viral, I guess, administration of a gene, and what viruses do is they implant their gene into our genetic code. Like most of our gene code is virus, which is kind of weird to think about. Like what? But that's how they implant genes into our genetic makeup. And what they've shown is that if you do this, it can be like a long form treatment where they don't need to be taking factor replacement therapy, where they're just injecting the factor that they don't have to supplement that. And that kind of sucks because you're having to deal with injections like 3 times a week, for the rest of your life. Type thing.
Yeah.
But there's also newer therapies like antibodies that are weekly. There's also extended half-life factors where they kind of like add on different things, like this big, huge side chain that prevents it from getting broken down from the body, where they have to inject fewer times a week. But trying to prevent those hospitalizations is like a very big thing, both for, money purposes, but also if you're a hemophilia patient, you don't want to be going to the hospital monthly. I mean, that sucks. So I've been doing like a deep dive into the different treatments for it and what UNC Health, University of North Carolina Health System, how they treat it, and trying to kind of optimize that and seeing where we can do better in patient satisfaction and outcomes.
Yeah.
While also, trying to limit costs, because cost per patient can be upwards of like $700,000 a year, just in treatment per patient. So if there's like 100 patients, I mean that's a lot of fucking money on a very small subset of the population, because like they're seeing thousands of patients. So to have 100 patients account for 10% of all spend, like there's got to be some way to kind of minimize that, because then you have the people that don't require a lot that are having to pay for these people because that's how insurance works, right? Like everybody pays into a pool, and then that insurance company uses that money to pay for everybody. That's generally like very high level, like how insurance works.